is sponsored by Mercy Health. So much is changing with the pandemic. It's hard to keep up with what all the numbers and the warnings mean. Dr. Justin Grill is the Chief Medical Officer at Mercy Health Muskegon, and Dr. Claudia Jaron is an infectious disease expert, also from Mercy Health in Muskegon. And thank you to both of you for being with us. Let's get the lay of the land. What's happening with COVID right now in Michigan and particularly in Muskegon?
So COVID is definitely spreading very fast and very hard in Michigan, and particularly in West Michigan. And Muskegon has definitely been severely affected. Our COVID numbers continue to rise, and the positivity rate for the Muskegon County also continues to rise. We have a positivity rate over 23%, and that means that over 23% of tests that are being done come back positive for the COVID virus. So we know that our hospitals all over the state, but again, particularly in Muskegon and on the west side of the state, are overwhelmed with several hospitalized patients with COVID, and also several patients who have conditions other than COVID.
So Dr. Grill, how is Mercy Health Muskegon responding to the demand?
That's a great question. We're really looking at this as sort of a multifactorial approach to managing this surge. So we've done some operational changes, such as we've delayed elective inpatient surgeries. We're still doing emergent and medically urgent cases, of course, but the elective ones that can be delayed, we've delayed. That allows us to have some additional inpatient capacity to deal with these COVID patients. We've done things such as worked with nursing agencies to contract with nurses from elsewhere to come into Muskegon to help our existing staff who are doing a tremendously good job. But obviously, this is a significant burden on them to take care of such a huge patient population all at once. Yeah. And of course, we're now opening the Hackley campus. And so that's a third opportunity that we have in order to help manage the surge.
So then will Hackley stay open?
That's a really good question. And the long-term answer to that is no. So what we've done is we've opened Hackley Hospital right now. As all of the viewers are watching this, we are taking care of COVID patients at the Hackley campus. Our plan right now is through this surge that we're experiencing is to continue to keep Hackley open. We've opened 10 beds. By early next week, we'll have 20 beds open. We're preparing for another 20-bed unit and then another 20-bed unit after that, where we can continue to offload the acute care hospital here at Mercy, take care of those patients at Hackley. There will be no emergency department at Hackley. We're not reopening it as a full hospital, so people can't go there for direct admission. And then when we're through this surge, the plan will be to close Hackley back down again, and we still will donate it to the local public school where their plan is the voters approved the millage to build a new middle school on that site. So that plan is unchanged.
Okay, so now if people happen to be experiencing COVID symptoms, what should they do? Are they in need of testing? Where do they go?
That's a great question. I'm glad you asked it. So if somebody is just curious, let's say, do I have COVID? Do I not have COVID? Maybe they have no symptoms. They were just exposed. We would ask them to first call their primary care physician's office. If they have mild symptoms, let's say you've got a headache, a runny nose, a sore throat, and you think, boy, from what I've read, those can be COVID symptoms, but you're really not that sick, we would encourage you to either call your primary care physician or go to an urgent care for evaluation. If, however, you have significant shortness of breath or you have uncontrollable coughing where it feels like you can't breathe or you're really, really sick and you think you need emergent care, those are the patients that we're asking still come to our emergency department. The emergency department at the Mercy campus is open 24 hours a day. We're happy to see patients. We're just asking for the community, if you're not that sick, call your doctor first or go to an urgent care. But if you need emergency level care, we are open and we're there to see you. Even if you don't have COVID, if you think you might be having a heart attack, you might be having a stroke, please don't delay coming into the hospital. We're open and we have a safe way to take care of you.
I know too that you all want folks to think about your dedicated colleagues during this time. They're working so hard to keep the rest of us safe. And so if you get a chance, folks, to show your gratitude, please do that. And of course, listen to the experts. They know what they're talking about. Bottom line, do not show up at Hackley. Thank those frontline workers. And I thank the both of you for being with us. Really appreciate it.
Yeah, thanks for having us.
Thank you.
Sure. More information on our website, 13onyourside.com.